I spoke to a woman yesterday who has had chronic nasal congestion for the past 5 months. She has no history of allergies, she doesn't feel sick, it's uncomfortable to her, and it's not responding to Reactine and other over-the-counter types of decongestants. Her doctor suggested stronger decongestants, which she didn't want to take. She wants to figure out what it is. So she's scheduled to go for allergy tests, but in the meantime, it's what to do about that. So I asked her, in addition to all the physical questions, what do you eat, where do you sleep, what's the air like in your place, all types of explorations of things that could affect congestion. I also asked her, well, what happened 5 months ago? You've had this for 5 months. Did anything significant happen in your life 5 months ago? And she said yes. She just came back from a year of traveling and she moved back to Toronto. So I asked her, well, how did you feel about moving back to Toronto? And that took her a bit off guard. She said, are you implying that this is mental? And I said, well, not necessarily, we don't know, we're just exploring all the possibilities. So first they found it interesting that even the suggestion that something could be mental was already opening the door where someone could feel a little bit defensive. And in truth, she relaxed about it and we carried on. But that just sort of speaks to the stigma that exists around the idea that anything that is mental or emotional showing up in the body, that there's some shame, which there ought not to be, but there still is. So then she said to me, well, even if it were the case, how could you prove that? And so I said, well, we'll do basic elimination tests. You'll use a saline wash through your nose for a few weeks. You'll reduce eating foods that produce a lot of mucus, and we'll see if there's a response. The next step would be to get an air purifier because there's some question about the air quality in her condo. And then when you treat anything with basic physical measures and you see how it responds, and if the problem is hygienic, meaning it's caused by the environment, there's something external to her that's causing this reaction, then you would expect to see a relatively swift and quick resolution by changing external factors. If the condition is a little bit more complex and is caused by something which is some other physical weakness we have yet to uncover, or by the somatizing of mental stress or emotions, then you wouldn't expect to see such a reaction. When the emotions get somatized in the body, basic physical measures that would normally improve the condition usually don't. So for example, people who have pain and there's a lot of emotion, if you take pain medication, they're not as responsive as people who have really just had a physical injury. So these are the ways, you slowly investigate, and if you determine that there's something emotional, well then that's just like a whole other process that you can explore how to move emotions out of the body. But it's just really good to know and to approach all of it, with an open mind, without judgment, just all of it as an inquiry.